topic, which is how does cancer present? As I mentioned before in one of my live broadcastings in my YouTube channel about human cancer prevention, that cancer or malignancy is one of the leading causes of death in humans or among human beings. And cancer is, in many cases, untreatable, and there is no recovery, or there is no cure, although we give medications or treatments. Only few types of cancer, especially hematological malignancies, are treatable. Like some types of leukemias and like Hodgkin's disease and some types of plasma cell dyscrasias like multiple myeloma. But in general, cancer affecting solid organs and affecting the blood, they are in most cases not curable. We just try to improve the quality of life of patients and improve symptoms delay morbidity and delay mortality in such cases. But ultimately, the life span, although it is variable from cancer to cancer and from patient to patient, there is a predictable what we call life span or life expectancy among patients with cancer. How does cancer present? This is the topic of my presentation today. What are the presenting symptoms of malignancy or cancer? The most common presenting symptoms which people should be aware of when it happens are classified in two main groups, either non-specific, what we call non-specific symptoms of cancer, or more specific symptoms of cancer. First of all, I will talk about the non-specific symptoms or presenting symptoms of cancer. Although, as we all know, cancer is two main pathologic types, carcinoma and sarcoma. Sarcoma is more malignant, is more aggressive, and is associated with shorter lifespan. Carcinoma, on the other hand, is less aggressive than sarcoma and is associated with longer lifespan. And most of the cases of cancer are among the carcinoma group pathologically, although sarcoma happens in some organs, but it rarely occurs. Among the presenting symptoms of cancer, as I mentioned, non-specific symptoms of cancer are number one, unexplained loss of weight. Any patient with loss of weight, he or she has to seek for medical advice. Loss of weight. Also, cachexia or severe loss of weight can be one of the important presentations of cancer. Unexplained loss of weight. We should search for medical advice because this may reflect a hidden malignancy. Number two is the loss of appetite or anorexia. Also, unexplained loss of appetite for a long time. We should also consult a healthcare professional for investigations and for further management of the case. So, loss of weight and loss of appetite. Also, unexplained weakness or chronic fatigue. We should also be suspicious about hidden malignancy, and we should search for medical, or the patient should search for medical advice. So, and also for physicians, especially junior physicians, to which patients present, any patient, please, any patient with unexplained progressive fatigue or general weakness, especially if associated with change in weight, that is loss of weight or loss of appetite, we should start investigating the patient for a hidden chronic disease, especially a malignancy, and we should put the patient under observation, and we should follow up these patients with investigations from time to time. We should not leave them. We should put them under observation. We should ask them to come for follow-up visits. So unexplained weakness and chronic fatigue also may reflect hidden malignancy. Also, unexplained anemia. When there is anemia, that is a problem of hemoglobin of the patients, which is unexplained and progressive, especially in patients presenting with normocytic normochromic anemia, or patients presenting with hypochromic microcytic anemia. Hypochromic microcytic anemia reflect a chronic blood loss, which may be due to malignancy, especially malignancy associated with blood loss, especially gastrointestinal malignancy, like cancer colon or cancer stomach or other types of gut cancer, or may reflect also some types of respiratory malignancies, especially lung cancer associated with chronic hemoptysis. There is, or urinary tract cancers like bladder cancer or hypernephroma of the kidney, or other types of urogenital malignancies associated with hematuria. So because hematuria or hematochezia or bleeding per rectum or hemoptysis, they all may reflect or may be symptoms of malignancies, the bleeding per rectum malignancy of the gut, the hemoptysis respiratory malignancy like lung cancer, whether small cell lung cancer or non-small cell lung cancer, and also hematuria may reflect urogenital malignancy, especially if painless hematuria, which may be associated with hypernephroma or renal cancer. And these types of chronic blood loss will ultimately cause what we call microcytic hypochromic anemia. And malignancy in general, even if not associated with blood loss, they might cause a type of anemia, which we call it anemia of chronic disease. And this is morphologically normocytic normochromic anemia, unlike the microcytic hypochromic anemia of iron deficiency associated with blood loss. So whether normocytic normochromic anemia or microcytic hypochromic anemia, this may be presenting features of malignancy or cancer. Also, among the presenting manifestations or presenting symptoms of cancer, maybe a problem related to the specific organ affected, that is more specific symptoms. And the most common specific symptoms are swelling or what we call lump, especially in the breast. A breast lump should be investigated for possible breast cancer. So when a lady feels a lump or a suspicious swelling in her breast, she should consult. It may be benign disease of the breast, any nodular breast disease, benign, or it may be breast cancer. So a lump in the breast also we should be aware of, and any lady especially past 20 years old should always check her breast for possible lump, and she should consult healthcare professional or a doctor for investigations, because a lump may be due to malignancy. But not all lumps are malignant, of course. We have benign lumps, but this is just to be careful and to be aware, and to raise the health appraisal of people about the nature of a lump. A lump means a swelling, and this is most common in breast and breast cancer, or maybe lump in the testicle, in testicular cancer or scrotal malignancy in males, or maybe lump in the skin, and this is also another manifestation. So a lump might raise suspicion of some type of tumor, whether benign or malignant. Also, other than swelling, maybe pain or dull aching pain or ache in a particular part of the body, like abdominal pain or chest pain or head pain. Headache may be a manifestation of intracranial tumors. That's why any chronic progressive headache, especially if early morning headache, if associated with vomiting, and if generalized headache, and if associated with other neurological features, and as I mentioned, it's most commonly early morning and may be associated with disturbance of consciousness, or may be associated with early morning vomiting. We should investigate for possible intracranial tumors. Headache may be a presentation of intracranial tumors. So this is a pain in the head. So pain in the head may point to intracranial space-occupying lesions in general, including tumors. And also pain in the chest, especially dull aching pain of the chest, may reflect some chest malignancy, especially patients with mesothelioma or pleural malignancy, which is a malignant tumor affecting the pleural space or the pleural membrane. And it may present with dull aching pain of the chest. Mediastinal tumors can also present with dull aching pain of the chest. Lung cancer can present with dull aching pain of the chest if the lung cancer involves the pleura and then the chest wall. Also, abdominal pain may be due to some abdominal cancer, especially cancer affecting the liver. The liver may present as abdominal mass in the right side of the abdomen, upper abdominal mass or abdominal swelling, or may present with right upper abdominal pain or aching pain of the right abdomen. And this also may be presenting features of liver cancer or hepatic carcinoma. So pain may be a presenting feature, pain somewhere in the body, whether in the abdomen, in the chest, in the head, that's headache, or even pain in the extremities, pain in the limb may reflect a bone tumor, or like osteogenic sarcoma, like a bone metastasis, like pain in the back, in the spine, may reflect also spinal tumor, whether primary spinal tumors or secondaries in the spine. That's the vertebral column metastasis. So it may be due to primary tumor or metastasis that is secondaries in the spine. So pain in the back, pain in the limb, in the periphery, pain in the abdomen, pain in the chest, pain in the head, they are all might be features of presenting features of malignancy. Also, the skin problems may be presenting features, and this is an important observation, that skin unspecific or non-specified skin rash may reflect some types of systemic malignancy. As I explained before, in what we call dermatological manifestations of systemic diseases, that among the systemic diseases which may reflect itself in the skin or appear in the skin is malignancy. And this is what we call the dermatologic manifestations of some systemic malignancy. Whether these dermatologic manifestations are due to, for example, metastasis or non-metastatic, or what we call paraneoplastic dermatologic manifestations. Paraneoplastic dermatologic manifestations of systemic malignancy. Many solid malignancies, especially malignancy of the gut or malignancy of the pancreas or malignancy of the lung or malignancy of the breast, they show some types of rashes, and some of these rashes in the skin might be characteristic of malignancy, like the specific dermatologic rashes of pancreatic tumors, which we see, for example, in patients with erythema gyratum repens associated with some pancreatic endocrine tumors. And also necrolytic migratory erythema, which is associated with some systemic malignancies. These are specific types of erythemas of the skin or reddish skin rashes, which reflect an internal malignancy. So malignancies may reflect themselves as some type of skin rash. That's why any patient with a skin rash, we should search for medical advice, because this might not only indicate a skin disease, no, it might indicate a systemic disease. And this is especially common and may be a presenting feature of systemic malignancy as I mentioned, whether solid organ malignancies, especially malignancies affecting the gastrointestinal tract or malignancies affecting the accessory organs of the gastrointestinal tracts, like pancreatic malignancies or pancreatic tumors, they might show themselves in the skin. Also, skin rashes may be associated with hematological malignancies, fluid malignancies, especially of the blood, patients with lymphomas, whether it is what we call skin lymphomas or some types of lymphomas which affect the skin, like the Sézary syndrome or like the B-cell lymphomas, or Burkitt's lymphomas, which show primarily in the skin. It might also be a feature of a systemic malignancy or a lymphoma, systemic lymphoma, whether non-Hodgkin's, especially in non-Hodgkin's lymphomas, which commonly present with lymphadenopathy or lymph node swellings, localized or generalized, and they might be associated with dermatologic rashes or also pruritus. So dermatologic rashes, especially erythemas or more or nodular skin rashes or maculopapular skin rashes or scaly skin rashes, whatever the morphologic type of the skin rash, this skin rash may be due to a systemic malignancy. Also, among the presenting features of cancer is the lymph node swelling or lymphadenopathy. So, any patient with lymph node swelling, especially if it is localized or maybe generalized, especially affecting the superficial groups of lymph nodes, more commonly or most commonly the cervical lymph nodes, the lymph nodes present in the neck, or axillary lymph nodes present in the axilla or in the armpit, or inguinal lymph nodes present in the groins, or other peripheral lymph nodes in the popliteal fossa or in the cubital fossa, or these groups which I mentioned called peripheral lymph nodes. In addition to the visceral lymph nodes like the mediastinal lymph nodes, the abdominal lymph nodes, the retroperitoneal lymph nodes, these are visceral or internal lymph nodes, different from the peripheral lymph nodes in the neck, which I mentioned in the neck, or in the axilla, or in the groins. If the patient presenting with swelling in the neck, swellings in the neck, this might be a lymphadenopathy. And any patient with lymphadenopathy, whether localized lymphadenopathy that is present affecting the one or two groups of lymph nodes, or more diffuse lymphadenopathy affecting three or more groups of lymph nodes in the neck, or in the axilla, or in the groins, that is in the inguinal region, we should investigate for possible malignancy. If it is cervical lymph nodes, we should investigate for head and neck cancer. If it is in the axilla, we should investigate for breast cancer. If it is in the groins, we should investigate for pelvic malignancies or malignancy in the pelvi-abdominal area, if it is in the groins. If it is in the testicles, also we should investigate for scrotal, or in the scrotum, we should investigate for scrotal tumor or scrotal malignancy in males. Although not all lymph nodes in the neck reflect only head and neck malignancy, the lymph nodes in the neck may be due to a pelvi-abdominal problem, like what we call the Virchow's nodes or the Troisier sign, which is enlargement of the supraclavicular nodes, especially on the left side in patients with abdominal malignancies and in patients with testicular malignancies. This is Troisier sign or the Virchow's nodes, which are enlargement of nodes at the base of the neck or supraclavicular nodes, which are part of the cervical lymph nodes due to abdominal or pelvi-abdominal malignancies. So anyway, lymphadenopathy may be a presenting feature of malignancy, that is enlargement of lymph nodes presenting as swellings in the neck, swellings in the axilla, swellings in the groins or inguinal region, which is the area or the junction between the lower abdomen and the upper thigh. We call it the groin. So lymphadenopathy may be a presenting feature. Jaundice may be a presenting feature of malignancy. Skin rashes may be a presenting feature of malignancy. Fever may be a presenting features of malignancies. Not all or not every fever is infection. Yes, infections represent the majority of cases of febrile patients or patients who present with fever. Number one, we think of infection, whether bacterial, viral, fungal, parasitic, protozoal, whatever infection. This is the most common cause of fever, but there is other causes of fever, especially in patients with chronic fever or patients with unexplained fever, which lasts more than 3 weeks and without detectable cause, and there is no evidence of infection. We call it fever or pyrexia of unknown origin. In patients with chronic fever or chronic recurrent fever of unknown origin, we should think about other causes of fever other than infection. And one of the non-infectious causes of fever is tumor or cancer. We have, of course, other causes like autoimmune diseases, vasculitic disorders, endocrine disorders, some metabolic disorders, as I mentioned, connective tissue diseases, other systemic diseases, familial Mediterranean fever, and cancer or malignancy. Malignancy is considered one of the non-infectious causes of chronic unexplained fever. So fever may be a presenting feature of malignancy. And of course, I have talked about the causes of fever and what is the pathogenesis of fever in patients with cancer, and I explained among them the release of pyrogens from some tumors or some metabolites from the tumors, and fever may be one of the presenting features or the non-specific features or presenting features of hidden malignancy. So also, patients with fever, especially chronic fever, unexplained fever, no evidence of infection, we should search for or investigate the patient for possible malignancy in the chest, in the lung, or in the gastrointestinal tract, or also in the blood, that is hematological malignancies. Leukemias might present with fever, especially acute leukemias and acute on chronic leukemias. Also, lymphomas may present with fever. Multiple myeloma may present with fever. Other plasma cell dyscrasias, other lymphoproliferative disorders, other myeloproliferative disorders may present with fever. Due to the tumor itself or due to immunosuppression and secondary infection in those patients with malignancies. So these are the presenting, most common presenting symptoms of malignancy. Other more specific symptoms related to the organ affected or the system affected. For example, cough is a common presenting symptom of lung cancer. Lung cancer can present with cough, can present with breathlessness, that is dyspnea, can present with chest pain, pleural pain, can present with hemoptysis, as I mentioned, and this is local respiratory symptoms due to lung cancer. Laryngeal cancer can present with change of voice or hoarseness of voice, and this is local symptoms due to some malignancy or tumor in the larynx. Abdominal pain, abdominal swelling can be presenting symptoms of gastrointestinal cancer. Diarrhea in some gut tumors, although constipation is more common in colon cancer. So patients with chronic constipation, especially if associated with some loss of weight, some anemia, we should investigate for colon cancer or lower gastrointestinal carcinoma, or even upper gastrointestinal carcinoma of this esophagus or of the stomach. So constipation, which is a colonic symptom, may reflect colon cancer. So chronic constipation, investigate for carcinoma, and we have to do endoscopy for such cases of chronic constipation. Diarrhea is less common as a manifestation of gastrointestinal malignancy, but maybe in patients with pancreatic tumors. Some pancreatic tumors and pancreatic malignancies, they might present with what we call secretory diarrhea. So diarrhea is rarer than carcinoma or rarer than constipation as a manifestation of gastrointestinal cancer. But both alteration of bowel habits, constipation or diarrhea, we should investigate in some cases, depending on the case. We should investigate, and we should have high degree of suspicion of gut cancer, that is carcinoma affecting the gastrointestinal tract. And Urogenital malignancies might present with hematuria. They might present with, and especially painless hematuria is danger sign of kidney tumors. Because painful hematuria more point to calculi, for example, the urinary calcular disease. But painless hematuria, we should be apprehensive of tumors of the kidney like hypernephroma. Also, they might present with lower abdominal swelling. It might present with some abdominal pain, especially pain in the loin or pain in the back, if there is some sort of obstructive uropathy in patients with prostatic cancer. Or in males with prostatic cancer. So hematuria, swelling, pain might be presenting features of urogenital tumors. And of course, late manifestations are renal failure, and these things are late features or late manifestations of urogenital tumors. Intracranial tumors, they most common, depends on the size of the tumor and the site of the tumor. Is it supratentorial or infratentorial? And the size of the tumor and the site of the tumor is very important, so that the tumor will be asymptomatic for a long time or present with specific symptoms, depending on, as I mentioned, on its size and on its site. The size, is it small intracranial space occupying lesion or large, and this is the size, and the site, is it where? Is it in a narrow area near vital centers or vital structures like in the brainstem tumors, which might affect the vital centers in the brainstem, or it is in the cerebellum presenting with cerebellar features or cerebellar syndrome, or it is in the cerebral hemispheres, depending on it. Is it in the frontal lobe or in the parietal lobe or in the temporal, to present with motor manifestations, neurological manifestations, sensory dysfunction, or may present with seizure disorders, that is epileptic features, or may present with headache of intracranial tumors, or may present with endocrine features if it is in the pituitary gland or in the hypothalamic pituitary area, might present with autonomic features, with endocrine features due to hormonal disturbance. So here it depends on the site and the size of the tumor, the intracranial tumor. These are more specific manifestations of malignancy or of tumors in general. And those cases which I mentioned, we should immediately seek medical advice. Patients, especially patients with non-specific skin features, skin manifestations, lymphadenopathy, fever, jaundice, pallor due to anemia, as I mentioned, iron deficiency anemia or normocytic normochromic anemia of chronic disease. And we all know that malignancy or cancer is a chronic disease. It is included in this category of anemias. Or maybe also, also loss of weight, loss of appetite, cachexia. These are the most common manifestations or early features of human cancer. Any patient with unexplained weakness, fatigue, loss of weight, loss of appetite, or these features should ask medical advice for further investigations, please. Thank you so much, Professor Dr. Tarek Ali.